I would like to welcome everyone to the beautiful rotunda of our Luzerne County Courthouse. My name is Linda McClosky Houck, and I am the chair of the Luzerne County Council. Thank you to everyone for joining us here today. We are gathered here today specifically to shed light on the devastating impacts that the AHCA, the American Health Care Act, and the cuts to Medicaid will have on our community, in particular on the crisis we face combating opioid abuse. Luzerne County has made the national news for several reasons in the past year. Unfortunately, one of the reasons is that, like many other communities throughout the nation, our county has seen a huge increase in opioid addiction, and it has impacted our community in many ways. With us today to discuss the impact of this legislation is United States Senator Bob Casey, State Representative Eddie Depashinsky, Wilkes-Barre Fire Chief Jay Delaney, and Luzerne County Drug and Alcohol Administrator Steve Ross. Senator Casey will give us some insight into the legislation itself and how it will affect individuals seeking treatment, as well as the providers who seek to help them. Chief Delaney will highlight how these cuts to Medicaid will negatively impact opportunities for substance abusers to access treatment and how that translates to the streets of our communities. Steve Ross, the administrator of the Luzerne County Drug and Alcohol Program, will highlight the opioid crisis in this county and stress the devastating effects that cuts to Medicaid will have on the ability to get substance abuse treatment to those in need. I would also like to recognize Wilkes-Barre Mayor Tony George in attendance today. At this time, I would like to introduce Pennsylvania's senior senator in Washington, D.C. He works every day on behalf of Pennsylvania families, fighting to create jobs, advocating for the education and well-being of children, and pursuing a national security strategy that protects our interests and supports those who serve our country. He serves on 4 committees, including the Senate Finance Committee and the Senate Help Committee. He is also the highest-ranking Democrat on the Special Committee on Aging. He and his wife, Therese, have 4 daughters and live in Scranton. Please join me in welcoming United States Senator Bob Casey.
Linda, thank you so much. Appreciate it. Well, Linda, thanks very much. Are we okay here? Thanks very much for getting us started, or I should say, Madam Chair. That sounds more formal and more accurate. But thanks for getting us started. I want to thank everyone for being here today. The first thing I want to do today is to offer thanks and commendation for the people in this audience, the people behind me, and the people in this community, whether it's the city of Wilkes-Barre, led by the mayor, or whether it's folks working in county government, folks working in the nonprofit sector, or citizens themselves for working on this critically difficult issue that we know is opioid abuse. It's a scourge that's hit every part of our Commonwealth and our country. Just for example, in 2015 in Pennsylvania, more than 3,200, I think the actual number is 3,245 Pennsylvanians died from a drug overdose. Of that, little more than 3,200, 1,300 roughly of that number is just from opioid abuse, overdose deaths. So you can see the scale of it in Pennsylvania, and the numbers are the same in lots of states across the country proportionally. And we have to ask ourselves, in the midst of trying to get a handle on this problem, in the midst of trying to solve the problem, why would we ever cut the program that has the greatest impact on it over time, Medicaid, and in particular, Medicaid expansion? We know that, for example, in Pennsylvania, just because of Medicaid expansion, over 127,000 people in Pennsylvania are receiving substance use disorder services. That's because of Medicaid expansion. So as we're advancing and trying to make progress on a difficult problem, and everyone here understands that, why would we ever listen to a group of politicians in Washington saying that they want to cut Medicaid over the next couple of years, and especially over the next 10 or more years? Why would we ever go in the wrong direction when we're just starting to make progress on this issue? But you know what? There are some people in Washington who believe that's what we should do. The Senate health care bill should be defeated for lots of reasons. I could list many of them, but one of the most compelling reasons to defeat this bill, to stop this bill, is because of the adverse impact that it'll have on this effort that we've undertaken for years now, whether it's in Pennsylvania or any other state. We are making some progress now. We got a long way to go to bring those numbers down. And the people behind me and in this audience today understand that. But one of the worst things we could do is to listen to some politicians in Washington that want to cut Medicaid. Well, why do I say that? Well, because we know that in Washington, not only do they want to cut the Medicaid expansion, but they also want to put a cap, a per capita cap on spending for Medicaid. That's another bad idea. But you know, as bad as those two ideas are, to wind down the Medicaid expansion and to put a per capita cap on Medicaid, as bad as those ideas are, it's particularly insulting, if not obscene, when they want to do that and then you see a massive tax cut for the wealthiest Americans. You saw the chart which analyzed the House bill, which is very similar to the Senate bill. By the way, the Senate bill reduces those who are on Medicaid not by 14 million, like the House bill. The Senate bill reduces it by 15 million. So in many ways, the cuts are deeper in the Senate bill. But you saw the chart that was based upon the House bill. You add up all of the cuts to Medicaid for Pennsylvania over the course of a decade, and it's about $35 billion. That's bad enough, right? That's bad enough to put that cut on paper and on a chart. And then next to it, sorry about that, next to it, there's another chart that says almost that same number, about $33 billion, would be the tax cut for 400 households in the United States of America. I didn't say 400,000, I said 400 households get $33 billion while they're cutting Medicaid just in Pennsylvania by $35 billion. So you can see the injustice in that, the unfairness in that. So that's why I've used the word obscene to describe tax cuts in a health care bill when they're cutting Medicaid. I put out a report a couple of weeks ago. You can't see it from where you are, but here's the title of it: The Republican Health Care Plan, Retreating from the Fight Against the Opioid Epidemic. Senator Joe Manchin and I did a phone call with the press about this, and we talked about the adverse consequences of having Medicaid cuts right in the midst of the fight against opioid abuse. So we don't have to get into a lot of numbers. We know what Medicaid itself is doing to help people, to give people health care for kids, for low-income kids in rural areas and small towns and cities. We know what Medicaid means for people with disabilities, and we also know what Medicaid means for seniors trying to get into nursing homes. In fact, 2/3 of the Medicaid spending is for seniors. But we also know how important Medicaid has become just in the last couple of years, with Medicaid expansion especially, for dealing with the scourge and the horror of opioid abuse. This is a problem which is only getting worse, but at least we're starting to get our arms around the problem. And just as we're doing that, you got some politicians that want to cut Medicaid. It's a bad idea. It's wrong, and we're going to stop them from doing it. Thank you very much.
Thank you, Senator Casey. At this time, I would like to introduce our Pennsylvania State Representative, Eddie Day Pashinsky.
Thank you. Thank you very much, Linda. And thank you to all of you for being here today. There is no other issue that affects every single person in this room, in this country. Health care. I don't care how healthy you think you are. At some point in your life, you're going to need it. And right now in the United States of America, we spend double of what any other industrialized nation spends on health care. We spend $9,400 per capita. The next closest country is Germany at $5,000 and $4,000 and $3,000. First of all, you're being overcharged. Second of all, what the senator said. How absolutely inhumane. We're going to cut the program. We're going to take money away from the program so that people that need it won't have it. And we're going to give it to people that don't need it. These are millionaire billionaires. How does that possibly work? Senator, the work you're putting into this, I want to commend you. We are struggling. If we're spending double in this country, are you going to tell me that we don't have enough money to make sure that every American gets a basic plan? Are you going to tell me that we in the greatest country in the world cannot figure out how people can still be paid appropriately, and yet how we as American citizens will be able to go to our doctor when we're sick? We can do that. And for all the criticism to President Obama and the Affordable Care Act, that was the start. That was the start. Tell me, what is wrong? What is wrong with making sure that people that have pre-existing conditions will be able to get health care? Is there something wrong with that? The person that has cancer, they didn't want it. They didn't do something to get it. It's just the way it is. Affordable Care Act said, you know what? If you, unfortunately, have been stricken by cancer, that will totally obliterate you financially, that will put you in the poorhouse, we're going to take care of you. Why? Because we are the United States of America. We have been taught from day one, to look out for those that do not have. We were taught within our churches to take care of those that couldn't take care of themselves. This is inhumane. Thank God we have Senator Casey. Thank God we have him here. There are a lot of other people that want to share some things with you. And I'm getting a little emotional here, so I think it's going to be time for me to pass the torch over. But I can tell you that I'm looking forward. Senator Casey and I have been trying to work out a time when we can meet. We're going to meet after this wonderful press conference today, where we can discuss the strategy going forward. You people stand up for your right. This is America. Everybody in America should have health care. That is a right. It's not a privilege. We can do it if we work together. Thank you, Senator. Thank you very much, Senator.
Thanks, Eddie.
Thank you. Our next speaker is the City of Wilkes-Barre Fire Chief. He was hired by Wilkes-Barre in 1981 as a paramedic, became a firefighter in 1993, was made captain in 1999, and later that year was promoted to battalion chief and training officer. He has over 36 years of experience as a firefighter and paramedic, with more than 12 of those years as the fire chief. Please join me in welcoming Wilkes-Barre Fire Chief Jay Delaney.
That's a fine introduction. Thank you and good morning to all. During the past 5 years, the opioid epidemic has increased by 248%. Never in my career have I seen something so destructive take so many lives. In the city of Wilkes-Barre, we chose to get aggressive with the opioid fight about 2 years ago with our naloxone program. From January to June of this year, the Wilkes-Barre Fire Department administered naloxone 195 times. That's for fire and EMS. Just think of the consequences if we did not have this drug. This is not just a Wilkes-Barre or Luzerne County issue. This is a nationwide epidemic. This is not just one demographic group. Some patients are young, some patients are old. Male and females are split 50-50. It runs from urban to rural Pennsylvania and all across the country. Yes, 50% of the overdoses are from heroin. Sometimes the heroin's laced with fentanyl and carfentanil, which are high-potency drugs. But the other 50% are prescription opioids. These people are from all walks of lives. Narcan funding for the first responder community is mandated if we're going to save lives. The second, and equally important part of the opioid epidemic is advanced clinical care, so we don't see the same patients over and over again, sometimes in the same day. At this stage, we're losing the war on the opioid battle in the streets. Without additional resources and the proposed cuts to Medicaid, I see the number of opioid deaths continuing to climb at an alarming rate. Remember, these are sons and daughters, mothers and fathers, grandmothers and grandfathers. This is not the time to relax our healthcare efforts on this nationwide epidemic. Senator Casey, 2 years ago, I wrote you a detailed letter about the need for the resources to combat this war on opioids. I appreciate your unwavering support for just what you're doing with the Medicaid cuts. Should we lose those needed financial dollars, I'm really alarmed at what this is going to do for our efforts in the street. 195 times in 6 months. Imagine if we didn't have those resources. And again, you might say, what are you talking about, grandmothers and grandfathers? The prescription opioids are hitting everyone, everywhere. This is not a certain demographic group. This is an everyone group. So I appreciate your support. Chief, thank you.
Thank you, Chief Delaney. Our final speaker this morning is the administrator of the Luzerne County Drug and Alcohol Program. He is a lifelong Luzerne County resident who earned a bachelor's degree in business administration from Wilkes-Barre University. He worked as the county agency's chief fiscal officer for 18 years prior to accepting his role as administrator of the county drug and alcohol department in September of 2016. Please join me in welcoming Steve Ross.
Thank you, Ms. Houck, and thank you, Senator Casey, for being here today and for your support in terms of this important and dire need. And thank you, Representative Paszynski, for your passion for the drug and alcohol cause at the state level. Again, my name is Steve Ross, and I'm the director of the Luzerne, Wyoming County's Drug and Alcohol Program. Our office is responsible for the drug and alcohol treatment needs of the uninsured residents of Luzerne and Wyoming counties. Historically, our office has continued to see more of a demand for services than we've had resources available. However, we do the best we can with what we have to give whatever treatment we can to those who are in such dire need. But I've got to tell you that demand for services has never been greater than it is today, as we in the last several years find ourselves in the middle of an opioid epidemic. In 2016, there were 142 confirmed deaths in Luzerne County as the direct result of an opioid overdose. In speaking with the coroner's office late last week, the end of June, halfway through 2017, we are at 65 confirmed overdose deaths, with 7 more open pending cases. That's 72 deaths halfway through the year. Do the math and double it, and we are, sadly to say, on target to meet or exceed the same number of deaths that we experienced last year. 142. If you do the math and break that down, that's 1 person every 2.5 days. That means in Luzerne County, we are losing one of our residents every 2.5 days to an opioid overdose. My good friend Chief Jay Delaney here talked about the 190-some doses of Narcan that he administered. He and the Wilkes-Barre EMS department administered in Wilkes-Barre in the first 6 months of this year. That's 190-some lives saved. Now that doesn't end there. Those people are in dire need of treatment, and that's what we're here to do. During this last fiscal year, which just ended this past weekend, of the hundreds and hundreds of people that we saw through our office who were deemed in need of inpatient care, I need to tell you, 6 out of 10 of them reported heroin as their primary drug of choice. Folks, I share these statistics with you because I hope that people will recognize just how severe and just how real this problem is. And any future cuts to drug and alcohol treatment, whether it be on a local, state, or federal level, will be crippling to our program. Not just to our program, but to the residents of Luzerne County, to the members of their family, and to our community at large. So as I close my remarks, I'd like you to remember 2 things. I want you to remember that number, 2.5. Every 2.5 days, we're losing somebody in Luzerne County to an opioid overdose. And secondly, I want you to think about what potential cuts to Medicaid are going to do to that number. Folks, we can't afford it. Thank you.
Thank you. To bring the message here today full circle, I want to again highlight that the proposed health care bill and the cuts to Medicaid will only help to fuel our opioid crisis and keep it going at an even greater pace. You know, it's one thing to say that the opioid crisis impacts our community. It leads to more crime, more stresses on our human service agencies, and more need for well-trained emergency responders. But it also hits home in a personal way and has a very real impact on our families. Our families who want nothing more than to help their loved one fight the disease of addiction and to return to them armed with the tools of recovery. For our community and for the residents and the families of this county and of our entire nation, we must continue to fight this fight with Senator Casey so that we will have the tools we need to continue to work and combat the opioid crisis here in Luzerne County and in the nation. We can't afford more deaths, more overdoses, and less Medicaid coverage for those who need help to live productive lives and to beat the scourge of addiction. I want to thank Representative Pashinsky, Chief Jay Delaney, and Steve Ross, and especially Senator Bob Casey for continuing to fight for the well-being of our communities and of our people. Senator Casey and the other speakers will be happy to speak to the press. Thank you again for attending, and have a great 4th of July holiday.
Thank you, Linda. Linda, great job.
Thanks, Senator.